Hi, I'm Donna Ciliska, and I'm the Scientific Director of the National Collaborating Center for Methods and Tools and a professor at McMaster University. The National Collaborating Center is funded by the Public Health Agency of Canada and located at McMaster in Hamilton. This session is part 2 of Evidence-Informed Public Health, where we're going to be talking about tricks about searching, how to find the best available evidence in an efficient way. The entire process, just to review, is to define the question, to conduct an efficient search, to critically appraise the information that you find, and then put it together in a synthesis of what does all of this information mean as a total package, to adapt that to the local situation, implement the intervention with healthcare practitioners and policymakers, and then to evaluate what impact that implementation has had both on practitioner change, policy change, and then on actual change in the community. So this session is about searching and making your literature search most efficient. This is a tool that Brian Haynes initially developed and has been further developed by he and Alba DiCenzo and Liz Bailey at McMaster University, and it's a tool to help you efficiently search. If you understand how the research is built up about a particular question, you can see it starts with individual studies at the bottom. That moves up into systematic reviews, where a systematic review is a process of putting together a large number or whatever number of studies exist about a particular issue. And then from there, guidelines are developed based on a number of systematic reviews. So we move up in these levels as the evidence grows. The converse, though, is to do an efficient search, is to start at the top. In public health, we have no systems really that are available for us for searching. They do exist in primary care, where there are automated office systems that require practitioners to do certain behaviors that are evidence-based, to order certain tests, to do particular examinations, but none of those exist in public health right now. For summaries, we have guidelines like the Registered Nurses Association of Ontario or the National Guideline Clearinghouse. For systematic reviews, we have several options in the Cochrane collaboration, in searching through PubMed, and through a great resource we have in Canada called Health Evidence. And then for individual studies, we have PubMed. So I'm going to go through some of these tools in a bit more depth. First of all, it's probably important that you understand what a systematic review is, because that is the taking individual studies and building it up to find an answer and some synthesis. The first part of systematic review is being clear about the question, defining a clear question, and then doing a very thorough search to identify all of the studies. And the thorough search requires that you look both for published and unpublished studies, because there's an important publication bias which indicates that studies that have no difference finding between an intervention and the control, or studies where the control actually does better than the intervention, are less likely to be written, less likely to be published, and so are not often included in systematic reviews unless you looked for those unpublished studies. So a very broad, deep, wide search is done for published and unpublished studies about the particular topic, the question that you've chosen. Then there's a process of going through all of these possible hits to make sure that they're actually relevant to this question. So the relevance check is done independently by two people, and they meet to discuss any disagreements they have about whether or not the study is relevant or not to the question. If it's relevant, it goes on to two independent reviews of the quality of the study, and again, the two reviewers would meet for any disagreements. And then two independent processes of data extraction, where people take out what actually was the intervention, who did it, what's the theoretical basis, and what's the outcome. What are the number of outcomes, probably. And then some analysis of the data. So this process is very rigorous. It's considered a type of research on its own. And from the probably 30 that I've done, they usually take a number of people up to a year to do. So that it's not a fast process, and it's not an inexpensive process, but it's a very thorough process. So the point is, if you're looking for an answer about a particular question, if you can find a systematic review that's been done, it's going to save you a lot of time in looking for and doing the quality appraisal and the synthesis of this information about the topic. So sometimes those systematic reviews are such that the outcomes can actually be put together statistically. So if the outcomes are measured in the same way across studies, they can be statistically combined to be called a meta-analysis. And this is a good example of what difference it makes if people wash their hands 10 times a day or more versus less than 10 times a day for the spread of respiratory viruses within an acute care situation. The meta-analysis is actually the diamond at the bottom of this graph. It's sometimes called the blobogram. The diamond at the bottom of the blobogram is the actual statistical combination of all of the results of the 6 studies that are included in this systematic review. So all meta-analysis are the result of systematic reviews, but not all systematic reviews end in a meta-analysis. So in this case, I can just give you the interpretation of what difference does it make if you wash your hands 10 times a day or more. The actual odds ratio is 0.45, so that means if you wash your hands more than 10 times a day, you can reduce the spread of respiratory viruses by one half, so a 50% reduction in the spread of respiratory viruses. Just for one other quick example, in this meta-analysis, the statistical results of 4 different studies were put together, and the diamond shows you that result at the bottom. This question was about what difference does it make if we do interventions in the schools to get kids to wear bicycle helmets. And you can see the odds ratio here is 4.3, which is a pretty dramatic increase in actual observed bicycle helmet use in children. So people actually stood at the playgrounds and watched children as they arrived and left the playground, and found if they did these interventions in the schools, they increased the use of bicycle helmets by almost 4.5 times. So meta-analysis gives you a very quick answer to your question, and it's based on a large input of resources of people to look for all the studies, do the quality appraisal of the studies, and do the data extraction of the studies for you to come up with a very clear answer. Health evidence is one of the best resources we have for public health in Canada, and it's a registry of reviews, systematic reviews of effectiveness of public health or health promotion interventions that are relevant to public health in Canada. So if you find the answer to your question, you know that it's already gone through this criteria of is it relevant to public health in Canada. Health evidence provides you with an abstract and a quality assessment. So 2 people actually independently rate the quality of the systematic review and tell you whether, on a scale of 1 to 10, whether it's low, moderate, or high quality systematic review. So it saves the next step in the process of having to do the critical appraisal of the systematic review. It sometimes gives you summary statements, so they don't have time to write summary statements for all 2,000 systematic reviews that exist currently in this database, but they've tried to write summary statements for the ones they think are of most importance and are of high quality that will impact on public health in Canada. They're structured the same way we talked about in the previous session about posing the question. They structure the question in PICO format, so you know the population of interest, the intervention, the comparison, and the outcome. And they tell you what the methodological strengths and weaknesses of the systematic review are, as well as the studies that are within the systematic review. Then they give you implications for policy and practice. So the summary statement can give you 2 or 3 pages, the real nuggets of information of what's important from the systematic review for you to pay attention to in public health in Canada. This is a quick look at the opening page of health evidence, and you'll see the search boxes in the top right. When you click on that button, you get a page that allows you to do free text searching. So where it says for articles containing, I've typed in helmet. I'm looking for the bicycle helmet interventions for children. And on the left, I've clicked on child health to try to restrict this search for systematic reviews to the age group that we're interested in. And after I search on that, I get this results page. And you'll see in the results page the listing of the titles of the systematic reviews on the left, the authors, the date of the publication, and then the actual rating. And in this case, I've chosen to show the results of the systematic reviews according to the rating, so starting with the ones that are strong. You'll see three reviews down beside the rating. There's a little PDF icon, and that icon demonstrates to you where the synopsis is, where's the 2 or 3 page summary for these systematic reviews. And this is another tool that's available to you called Public Health Plus. So this, in contrast to Health Evidence, which is all about systematic reviews, includes both systematic reviews and primary studies. The advantage of this database is that all of the articles within this database have already been filtered for high quality. So when you look in this database, you will only find the high quality research. You won't find all of the research that exists about a particular problem. In this process, the staff of the Health Information Research Unit actually read over 1,000 articles per week with standard quality criteria. Anything that passes their quality filter then goes on to be rated by experts. In our area of interest, it's about experts in public health. So it could be in communicable disease, in health promotion, and they rate the article for whether or not it's relevant to their practice, as well as whether or not it's newsworthy. So they rate on a scale of 1 to 7. Is it something that's just reaffirming what we've known for a long time, in which case it would be low on the newsworthy aspect, versus if it's something that's actually quite new and noteworthy for our practice. So anything that passes the quality criteria and then is rated at least a 4 out of 7 for both relevance and newsworthiness goes into the searchable database for Public Health Plus. So you end up with high quality, high relevance, and high newsworthy articles. So just really the nuggets of what's important and what's new in public health. This is updated on a weekly basis, and you'll see on our website you can have it sent directly to your email through an RSS feed. So a way of keeping up with the best information in public health. One other search strategy that will dramatically reduce the amount of time you spend searching. If you're not successful in finding a good systematic review in Health Evidence, if you're not successful in finding a high-quality article within Public Health Plus, the next line would be to go to PubMed. And PubMed is a free online database funded by the U.S. government, actually, for the rest of the world. And they have some built-in filters. So rather than just searching broadly in public health and finding thousands of articles, you can go to this circled area called Clinical Queries to get some filters that are already built in to help you find just the high-quality information. When you click on Clinical Queries, you find this screen and you'll see Find Systematic Reviews. Unlike when you search on PubMed generally and limit to reviews, you get opinion pieces and non-systematic reviews. This part of PubMed will actually help you find just the high-quality systematic reviews. So you can free text search, and I put in obesity in children and got a limited number of high-quality reviews. Now, this slide gives you an illustration of how these tools can save you time. For every one of the searches on the pyramid, I used exactly the same words. I used obesity and children, and I started at the bottom. Both students and staff who I interact with often start searching in Google. And in Google, when I put in obesity in children, I got 689,000 hits. And some people will say, well, I only use Google Scholar, and I get the best information that way. But the same search in Google Scholar was 307,000 hits, way too much for any practitioner to look at in a reasonable amount of time. When I searched generally in PubMed, it was 17,044 hits, again, way too many. Moving up, when I went to the synthesis level, In health evidence, I found 20 systematic reviews about obesity in children. So again, these would be quality assessed, and you could limit that search by only the high quality ones. When I used that filter in PubMed, the clinical queries, I found 153. So that's still a large number. The RNAO guidelines, there was one guideline in the National Guideline Clearinghouse, 121 guidelines. So in just one other point on the synopsis of syntheses, the health evidence actually had 2 of their 20 systematic reviews that gave you the 2 to 3 page summary about what the systematic review was telling us, the implications for practice and policy. So from looking at this pyramid and the number of hits with the same search, you would probably go directly to health evidence, and you would find the best information in 5 minutes if you had used that strategy. So we've looked at some tips for efficient searching, and if you want to review other stages of the evidence-informed public health process, you can go to our website for the National Collaborating Center for Methods and Tools. It's the www.nccmt.ca, or the French version is www.ccnmo.ca.